Hi, welcome to Let's Chat. We would like to thank our host, River Valley Community Bank, for sponsoring this wonderful program. I'm Valerie Costa, your host, and today we're chatting with Toby Guevin from Nevada County Public Health. Welcome, Toby.
Hi, Valerie. Thanks so much for having me.
You're very welcome. It is my pleasure. So tell me about what your role is in Nevada County Public Health.
Yeah, so Nevada County Public Health it's a county agency, and the way that I think about public health is, when you are not feeling well, you go to the doctor. For public health, we're really thinking and focusing on community health. So looking at assessing the community and then figuring out interventions and programs that we can develop to help support the community. My role within public health is the program manager of the Health and Wellness Division. We have 7 different programs within that. They're kind of community-based primary prevention programs, so in the schools and out in the community. And so my role is to manage that and work with staff to implement those.
Oh, that's great. So there are 7 programs that public health is in charge of. What are the 7 programs?
Yeah, so I'm going to do my best not to forget some of them because I always forget at least one.
I'll keep a finger count for you.
Okay, that sounds great. So the first one, we have our alcohol and other drug prevention program. And so there's kind of two main components of that. The first one is we do a lot of school-based programming, so presentations, educational presentations on cannabis or other drugs, alcohol. We also have school-based programming. So we go into the schools, we have what we call Friday Night Live programs where we go in at lunch or in after school to a school and we worked on lifting up protective factors. So we know that, for instance, young people are less likely to use drugs and alcohol if they have connections to caring adults or to peers. And so really trying to foster those relationships and build those up as protective factors. So that's part of the programming. And then we have kind of a special program around opioid overdose prevention. As folks are probably familiar, we have an overdose crisis in really the nation. Fentanyl-related overdose deaths is actually the leading cause of death among U.S. adults between 18 and 45. Ugh. And so over the last few years, as we've seen fentanyl arrive in Nevada County and have an impact, we've developed an opioid overdose prevention program and a campaign called the No Overdose Nevada County campaign. And really what we're trying to do is first educate as many people as possible about fentanyl, about opioids, about overdose awareness, and then also distributing Narcan, which is the opioid overdose reversal drug. So making sure that we have that accessible in the community so we can prevent as many overdoses as possible. So those are kind of the 2 primary components of the alcohol and other drug work that we do.
I love that because I grew up in the 80s, and so I was like in the age of Dare, and so we'd have like the guy come in and like we'd do skits, but like I was raised in the age of the babysitter smoked pot and then they put the baby in the oven. So I'm so glad that that's evolved into a more practical thing and kind of addressing the root causes. And as a mom in Nevada County, I'm thrilled about that.
Yeah, definitely. I mean, that's a good point. I mean, there really has been a sea change in the way that we approach education and outreach around that. And really, we have to understand why people are deciding to use drugs and address those root causes. That's so important. And at Public Health, that's really the approach that we take, is that harm reduction approach. So how do we prevent people from using, but then when they're using, how do we make sure that they're being as safe as possible when that's happening too? Because what we don't want to have is have overdoses and deaths in the community.
Yes, we definitely don't want that. So that was program 1.
That was program number 1.
What's program 2?
Program number 2, and I appreciate the
I'm
counting,
keeping the fingers at the ready.
So that's our CalFresh Healthy Living program. So that focuses on nutrition education and physical activity. And so there's a number of different kind of things that we do to do that. So we do direct education classes. So a series of classes that we'll do. We partner, for instance, with Connecting Point to do yoga classes, chair yoga classes to address some of the access barriers that there might be out in the community, but providing an opportunity for people to engage in kind of healthy physical activity. We do nutrition education. So actually there's a program here on Nevada County Media called, I believe it's Healthy Bites. Hopefully I'm getting that right, where we have a registered dietitian, Shauna Schultz, who comes in and she'll do cooking classes. So looking at what are some healthy recipes that we have, how do we integrate fruits and vegetables into our diet on a regular basis. And so we do those in schools, we do those out in the community, and then we also show up at events. So like I know there's, I think it's Spooky Booky is happening on the 31st on Halloween at the library. So we'll be there with some healthy recipes, with a Rethink Your Drink. So trying to move away from sugar-sweetened beverages and thinking about things like flavored water that are a little bit healthier for us. So focusing on that, and then we also do kind of more systems level change work. So we're actually about to start a really exciting partnership with Ready Springs down in Penn Valley, where we're going to be focused on food waste prevention, recovery, and redistribution. So how do we look at and teach students about how to prevent food waste and to save food, and then how are we thinking about systems within the lunchroom or within the broader community where we can prevent food waste and then get that food to families that need it. So those are a few of the programs that we have within CalFresh Healthy Living, and we're really trying to meet the needs too of people who are receiving CalFresh food benefits too, to make sure that they have access to that information and education.
That's wonderful. I know at the farmers market, I always see like, we accept SNAP. So I think that that's a wonderful thing that, people can buy, fresh, locally grown food. Big advocate of our local farmers and ranchers. So
definitely, yeah. And we're involved in the Food Policy Council here in Nevada County, which is something that Sierra Harvest convenes. Yes. And so really focusing on, that local food and healthy food for all of our families.
Oh, that's great. One thing Nevada County is very good at is partnering with local organizations, and that's something that I love about our local government. So, okay, 3. What is number 3?
Our third program, that's our HIV case management program, so the HIV Cares program. And so that works with people in Nevada County living with HIV and AIDS, and we provide non-medical case management, so looking at referrals to different community resources and providers. We also provide housing assistance, so we provide rent, mortgage, utility assistance for people who are living with HIV and AIDS who may be on the brink of homelessness. And then we also have the AIDS drug assistance program, so making sure that nobody in Nevada County can't access their prescriptions for HIV and AIDS because of cost. So either connecting them to through insurance or through Medi-Cal or other ways to make sure that we're covering their drugs and they have access to those.
Oh, that's wonderful.
Yeah.
What's number 4?
Okay, number 4 is our local oral health program. And so our local oral health program is really focused on making sure that young people, our kids in our schools, have access to appropriate dental care. The number one reason that students actually miss school is as a result of tooth decay, the pain associated with it. And so what we're really trying to do in California, we have a law, which is called the Kindergarten Oral Health Assessment, to ensure that everybody by the end of their kindergarten year has seen a dentist or a dental health professional. And so what we're doing right now is partnering with schools, and so we do screenings of all kindergarteners across Nevada County. We did 3 schools last Monday, and then we did 3 schools a few Mondays before that. And we're just making sure that all kindergartners have had a chance to have an oral health screening. So we bring a registered dental hygienist who will come in and do the screenings. And as we do the screenings, we'll look at providing them, if there's any urgent issues that are coming up, making sure that they have a referral, that they know about local dentists that might be able to help them out. And so really making sure that they that they have access to that dentist and that information. So that's a huge part of the program. But then we also do education out in the community. So I mentioned like Spooky Booky, as a good example. Like we love Halloween, we love candy, in a limited basis, right? But making sure that, wouldn't it be great to be able to give out oral health kits, right, to our kids in our community?
Kids love getting those in their trick-or-treat bag.
Oh, for sure, right? Along with raisins,
Yes, and apples.
Yeah, you can always spy the dentist, on the block. But so at that event, we'll be passing out free toothbrushes. We'll be passing out some books that are around oral health, right? So finding fun ways to integrate oral health. We go into the family resource centers, into classrooms for Children's Oral Health Month in February, we actually put together a collection of books that were around oral health for kids, and then provided those to all of the school libraries across the county.
So you're hitting all the candy holidays. You've got Halloween and Valentine's
There you go.
Day.
You want to know something? We just want to make sure that people, are thinking about prevention as they head into those days where we enjoy candy. So really doing that, but also thinking more comprehensively. We have a dental coalition, and so we have dentists locally. We have organizations that are working with kids. So getting them together on a quarterly basis to talk about what are we seeing in the community, what are some more kind of policy and systems level changes that we can integrate here locally. Access to providers is a huge challenge. So really thinking about how do we provide that access. That's why we have the school-based screenings, because we want to make sure that everybody has access to information about their oral health. So that's another one of our programs.
That's great. Number 5.
Number 5.
There.
Yeah, I'm going to do my best. And so that would be our suicide prevention program. And so really focusing on mental health and suicide prevention. So we do trainings really across the county to organizations in schools, to school staff, making sure that people have the training that they need to be able to identify what are the warning signs of suicide. And then if you see those in somebody, what are ways that we can engage with that person? How do we have that difficult conversation to let them know we're concerned about them? And then what are the local resources we have available to help? So if you know that somebody's thinking about suicide or just struggling with their mental health, what are the local resources that we have that people can access? So making sure that we're doing that training as broadly as possible, so we have more and more people across the community who are aware of what those warning signs are and can really be that helper who connects them to the professional help that they need. We also have a suicide prevention task force, which is kind of our, in Western Nevada County, our group of organizations who are working around mental health and suicide prevention. So working with them to identify, what are some systems level issues that we're experiencing. During the pandemic, when so many people were struggling with their mental health, and even now when so many people are struggling with their mental health, we developed the Let's Talk Nevada County campaign. So if you go to letstalknevadacounty.org, you can find kind of a one-stop shop for resources and information about mental health and suicide prevention, including the ability to request a training. All of our trainings through Nevada County Public Health are free. We're happy to provide them to anybody and accommodate them. I mentioned our opioid overdose prevention work. Just in 2023 alone, we've done over 80 trainings to more than 1,500 residents in Nevada County, and we'd love to increase those numbers by providing more training. So within suicide prevention, we do that, and then we also support the Tahoe Truckee Suicide Prevention Coalition, which is kind of a regional coalition that supports mental health and suicide prevention in the eastern side of the county. And so we really want to make sure that with all of our services that we're servicing the whole county, and that definitely includes Truckee and eastern Nevada County.
All right, 6.
All right. We got our tobacco prevention program. So really tobacco and vaping. I know vaping is a really big issue, for kids, for students, for families, for parents. And so we do a few things there. We focus on kind of policy level. So being able to educate policymakers about, what are some options that we have at a systems level for impacting it. So recently, California did the flavor ban. And so we're really working on, how do we implement that on a local level to make sure that we're keeping flavored tobacco products out of the hands of kids and off the market, really, right? We know that with there's thousands of flavors of vapes and tobacco products now that are really targeting kids. So how do we make sure that we're limiting access?
They also snuck menthol cigarettes in there.
Yeah. Exactly. So working on things like that to make sure that we're really addressing at a higher level access for kids in particular to those products. Another thing is multi-unit housing. A lot of us, or all of us.
7?
Well, that is within tobacco prevention. So within tobacco prevention, multi-unit housing, so we know about secondhand smoke, right? So when somebody's smoking or vaping, being around and actually inhaling that, what happens is in multi-unit housing where we have shared facilities, we have shared air vents, we have what's called third-hand smoke, where that smoke will actually travel within that. And so people can be exposed third-hand to smoke or vapes that's happening within multi-unit housing. And also vapes, they've done research, both vapes and smoking, it actually sticks in the walls. For a long period of time. And so we're really trying to think about and educate policymakers around what are some options that we have for limiting second and third hand smoke within multi-unit housing as well.
Wouldn't that kind of be infringement on personal liberty to like forbid people from what they do in their own homes?
Well, so with multi-unit housing, you have people who are kind of in the same location, right? Mm-hmm. They can't move, right? So you're being exposed to something. So people can continue to do what they want to do individually, right? But if it's affecting other people, right? If you're exposing other people when you're doing that, that's something that we want to look at. Not at existing properties, but thinking about down the road as properties are built, making sure that people understand what the impact of second and third hand smoke are, and how negatively that impacts people.
Yeah, that's a tough one.
For sure, yeah. And it's one of those things where our role is really, we're part of a network across California that supports policies, right? So we don't advocate for any specific policy, but we do provide education to the community and to policymakers about what options are.
Mm-hmm.
Seven. So 7 is our Women, Infant, and Children program. Mm-hmm. So that really works with folks in the community who are pregnant or up to the age of 5 and their families and supporting them. So there's a food benefits element to that, but there's also this really important piece that I didn't know about before I was involved in the program, which is really around education and supporting families, supporting parents. So we have breastfeeding peer counselors to help people through the who are breastfeeding. We have support when it comes to nutrition, parenting, a variety of different trainings that we're able to provide to families to make sure that they have access to the resources and information that they need when they do have young kiddos in their family or when they're pregnant. And then we also do a lot of referrals to community-based organizations to help provide additional supports to families. And so that program serves over 1,000 residents within Nevada County. And so it's such a critical resource to parents, to our youngest children, and that's a phenomenal program. And we have a whole team that works on that program over in the Brighton Greens complex. Yeah.
Well, that's great. Wow, you guys are doing a lot.
Yeah. We have a fantastic team at Nevada County Public Health generally, and within the Health and Wellness Division team. Oftentimes, it's one person who's supporting multiple programs or supporting a program, and so it's really important to us as we think about our role. We want everybody to have access to a healthy community. And so that's really what we're trying to do at Public Health. And a lot of these programs help us in addressing some of the real needs that we see.
All right. Well, thank you so much. Is there anything else we should know about public health? I think you've covered a lot.
No. This is just one division within public health. And so we have our nursing team, our public health nursing team, which does fantastic things. Our admin and operations team, which is doing a lot of collaboration and community health assessments. And then we also have our communicable disease team as well. So, we're really trying to make sure that Nevada County has a healthy community, and we're super thankful for all of the collaboration and the partners that we've developed in these programs. We couldn't do it without those, and so that includes Nevada County Media because we have the Healthy Bites program. We come in often. We've shot commercials for tobacco prevention and vaping prevention as well, and so those are all things that we're really appreciative of. So thanks so much. Yeah.
Thank you. And if one wanted to learn more about the programs that you offer, like the suicide prevention, or get on one of those trainings for the opioid overdose prevention, where would they go?
So the best place to reach us for all of our programs would be on our website, which is nevadacountyca.gov /public-health. Folks are also happy to reach out to me via email. Our phone number is 530-265-1450. So you can reach us there. For the opioid overdose prevention, the website is nooverdosenow.org. knownc.com. It's KNOW overdosenc.com. But if you put in no overdose, just NO overdose, it'll take you to the same place.
That's
so
smart.
We thought about that. Yeah, exactly.
Good, thinking ahead. I like when a government thinks ahead.
For sure. And then for the suicide prevention piece, letstalknevadacounty.org is the website, and we're actually going to be working in the coming months on a revamp of that and making sure that we're updating resources and information and the campaign to meet the needs of folks that they're experiencing right now.
Wonderful. Well, thank you so much, Toby, for enlightening us about all the amazing things that you and your department are doing.
Yep.
And thank you for joining us for this episode of Let's Chat. We'll see you next time.